Welcome back to the program tonight. Now, when we focus on COVID-19 and flattening the curve, there's a number of criteria that will be looked at. But before we get to that, let's understand the numbers. I know we'll talk about the 5%, but let's talk about today's numbers. That's the 17th of September. Over the last 24 hours, this is what the situation looks like in the country. 183 new infections were recorded from a sample size of 4,188. Now, if you've been calculating that positivity rate, it's at about 4.3% today. And all of this brings the total confirmed cases in the country to 36,576. Sadly, over the last 24 hours, 5 people lost their lives, bringing the total death toll in the country to 642. Now, like we're saying, today's positivity rate is at 4.3%. And this brings some hope, right? Because we have been focusing for quite some time now on that magic number that we've been told, right? Which is that if you have less than 5% positivity rate for 15 days straight, then it means you're well on your way to flattening the curve, right? Well, it's a little more than just that number. There's many criterion that we'll be taking a look at in totality and together before we can truly say we're flattening the curve. Now, this criterion has been put together by the World Health Organization and has been adopted by Kenya's Ministry of Health, and this is what they will be looking at. We'll get to the 5% in a moment. But first, this is an important thing to take a look at. There needs to be a decline in number of cases by 50% over 3 weeks, over a 3-week period, all right? Now, this should happen since the latest peak and should also be a continuous decline in the numbers of confirmed and probable cases. That is one criterion they will be taking a look at. The other one is the one that we have been talking about, and I know many people calculate this every day. The MOH releases the numbers. Less than 5% positivity over 2 weeks. Now, I calculated the numbers for the last 17 days. That's of the month of September. We have recorded less than 5% for 12 days this month. Even then, it is not consecutively as is required. All right. Today's positivity rate was at 4.3%, which is good because we want it lower than 5%. But we've even seen us going as low as 2.6%. That was recorded, I think, on the 6th of September. Now, it is important here for me to note that for the first and the second criterion, one thing must happen. This must happen under a condition of optimal testing. So what does optimal testing mean? Well, it could mean higher numbers, right? That we should be testing as many samples as possible. In fact, if you remember, there was a time in the country we're testing up to 8,000, 9,000 samples. And over the last few weeks, we've seen about an average of 3,000 to 4,000. Well, optimal testing isn't just about numbers, even though testing higher numbers is important, but it is also about timely testing, about testing the right people, about having effective contact tracing. Now, the idea of optimal testing is to test, isolate them so that you prevent the spread of the virus. Now, have we been doing optimal testing in the country? The MOH has admitted and said, well, not quite, because of a deficiency in the reagents that are required for testing. Also, another thing that many are asking is what's happening within the counties. They are having to wait long periods of time for their results to come back. And so this is what we start to talk about when it's optimal testing. So these two would only be very important if we are testing optimally. Are we? Well, perhaps not. Here's another thing that affects the testing. Some experts are calling it dilution of tests. Why? Because you're not just testing those who are at risk through contact tracing, but there's also lots of voluntary testing, as you know. Many organizations and health facilities and labs, private labs, are now offering this testing. Why? For people who want to travel. So these are not necessarily persons who are at risk, but they're coming in voluntarily. So is that a true depiction of the situation in the country? Those are some of the things we're going to look at, which is why just the 5% alone is not enough to tell whether we're flattening the curve. Here is another criterion that the Ministry of Health will be looking at, that at least 80% of the cases should be from contact lists and can be linked to known clusters. So what does this mean? Well, simply that you know where the cases are, that you have a very strong surveillance system that enables you to do robust contact tracing. You know where the virus is, you know where and how it is spreading. Now let me give it in the reverse. if you were to have 20% of your cases from known clusters, what does that mean? It means there's about 80% of people out there whom you don't know, who are undetected, who are undiagnosed, and possibly continuing to spread the virus. So that is an important thing that they will be looking at. And here is another one. You need, of course, a decline in the number of deaths amongst the confirmed cases. Now, whilst every death is regrettable, particularly for the 642 who have lost their lives in the country, and to them and their families, we offer our condolences. We're still told that Kenya is doing much better when it comes to what is called the case fatality rate, which is calculated as the number of deaths as a percentage of the confirmed cases. Now, Kenya's case fatality rate is at 1.7%, and this is far better than the global, which is at about 3.1, 3.2%. So we're doing averagely better than many other countries in the world, but obviously we want to see a decline in the number of deaths continuously over a weekly and a monthly basis before we can start to say that we're well on our way to flattening that curve. Now, the final one is about having continuous decline in the number of hospitalizations, which we're hearing is the case from some of the facilities like the Kenyatta University Hospital. Whether that is as a result of the declining numbers or the declining number of tests is another matter altogether. But we do know in the country that we have more in the home-based care program than in health facilities. In fact, we have also another factor here to consider, and that is ICU admissions. And as of Monday this week, Dr. Amoth, who's the Director General, said we have 22 in ICU, 17 on ventilatory support, and 5 on supplementary oxygen. So we'll also be taking a look at the resilience of our health facilities. Can they manage the cases that are coming in? There's another factor that is not here on my wall, but I will tell you about it. It is taking a look at the number of deaths from pneumonia. Now, what they will be doing is comparing all those numbers that they were getting across the different age groups from what we have known before COVID, and then taking a look at what the deaths to do with pneumonia or that have been attributed to pneumonia at the moment. Now, why is this important? Because pneumonia, just like COVID-19, is a respiratory infection. Now, in case there could have been some cases that were undetected, undiagnosed, and presented as pneumonia, you would want to know if there is a spike, because that would tell you that there are some people who were not tested, but were said to have died of pneumonia when it could, in fact, have been COVID-19. So these are all of the criteria that they will be taking a look at. Not just the 5% positivity rate or less for 15 straight days. Remember, we haven't had that in the month of September. They'll be taking a look at all of that together before we can truly say that we are flattening the curve. That's